I don't think I could have possibly imagined the power of the speakers.
We're always challenged to take the best of what we learn about the other countries and adapt those to the Canadian context.
It's a whole new lens on what I do, how I do it.
You're really sitting in a forum at the feet of giants, listening to how they shaped systems.
What that means is that we all see new perspectives.
And how to drive, promote, lead real system level change.
We did a fair bit of research before we launched the program, and we concluded that the niche that was not being filled would be a program that would combine a lot of leadership development, but also building in a very significant amount of content regarding to health system performance.
If I look at the participants, we've got a diversity of students from the East Coast to the West Coast.
We have senior healthcare leaders who are managing health services. We have government people.
We have executives to physicians that are in hands-on practice on a day-to-day basis.
So we've had a lot of different perspectives, and that really has proved very beneficial.
I'm the Director of Population Health with the Interior Health Authority.
So I work with the Ministry of Health. I'm the Executive Director of the Strategic Policy Branch.
I work at Cancer Care Ontario. It's the provincial cancer agency in Ontario.
The relevance of this program on a day-to-day basis has been incredible.
It's challenged us to take a broad systems view of the health system.
The biggest learning for me has been that there's no silver bullet, that to really achieve meaningful change in the system, we need to roll up our sleeves and look for those partners who can help us.
These are people that I can call months and years down the road to say, this is an issue that we're struggling with, or here's an opportunity that we're wanting to realize.
We're not just looking at the healthcare system. We are looking at the whole range of things that impact on the health status of a society.
It provides that perspective for us to understand, okay, these are my priorities, but what are the other people's priorities, and how do we work together to make the system work a little bit better?
We also build in throughout the program speakers from across Canada.
We've been learning from world leaders that are essentially giants in health system performance, quality of health systems. So for me, it was great to see many of the former deputies that I've heard from, worked with, and learned from in this panel forum. It was fantastic.
So part of each module, we build in I think called International Ideas Marketplace, where we expect all the groups to look at all the countries we looked at to pull the best ideas from all of that.
And the country that my team is looking at is the Netherlands, and they're doing some really interesting things around quality and how they regulate quality. It takes it from being what would be an academic exercise and make it very, very real and very practical. I would absolutely recommend this program. I benefited from it enormously and have thoroughly enjoyed it.
I'd recommend the program for policy leaders so that they can learn from their peers on the front line.
Anyone involved in health system change.
That have a passion for change and for improvement and for leadership.
So anyone that thinks they can do something different and make a difference with a group of other people, this is probably the program for them.
When I return to work, it's amazing. After just the 3 days here in Banff, I have a lot of inspiration, a lot of energy, and I can apply that to the work that I do.